Please be advised that the information in this podcast is for educational purposes only and should not be taken as medical advice. Before making a health decision, please consult a practicing medical professional. Thank you for your attention and enjoy today's episode. What is up, cooties and germs of the internet? My name is Tony, and you are listening to Hemp Nerd, the podcast that clarifies how medical cannabis works so you can get reliable therapeutic results. Now, in today's episode, we're going to be answering the question, does CBD oil work for plantar fasciitis? Now, as you know, if you are a regular listener to this podcast, the first thing we must do is firstly understand what plantar fasciitis is so we can effectively determine whether CBD oil is actually going to work for the treatment process that is involved with healing from this condition. So the first question we have today is, what is plantar fasciitis? And I hope I'm pronouncing this correctly because the medical industry has got so many fancy terms for all these conditions and medications and all these kind of things. It's literally like reading a different language or learning a whole different language. But hopefully I can become fluent in this language and I can also break this down for you moving forward. But right now it is a bit of a challenge for me to actually read some of these words and pronounce them properly. So I do apologize if I'm mispronouncing some of these words. Now let's get into it. What is plantar fasciitis? So it is described as the inflammation of your plantar fascia, right? Your plantar fascia is a strong piece of thick tissue that runs along the bottom of your foot. It connects your heel bone to your toes, creating the arc of your foot. Plantar fasciitis is one of the most common causes of heel pain. It has a high risk of occurrence in runners, overweight people, and people who wear shoes with inadequate support. Now, what causes plantar fasciitis? It is often associated with a heel spur. Now, a heel spur is a spike of bone poking out from your heel bone. However, many people have heel spurs. I don't know if I have one or not, but apparently many people have them, and they do not experience any pain. And the pain that does come from plantar fasciitis can be treated without removing your heel spur. Thus, heel spurs are actually not considered to be a cause of plantar fasciitis, even though it is often associated with the condition. Your plantar fascia is designed to absorb the stress and pressure you apply on your feet, when you're doing your walking or exercise, whatever it is that you do with your feet. However, too much pressure on your feet can tear your ligaments and damage your tissues. Your body's natural response to injury is inflammation, as we all know by this point. When your plantar fascia is injured and inflamed, the result is heel pain, stiffness, and swelling. Now, the medical community believes that plantar fasciitis can develop as a result of overstretching, overuse, misuse, or in relation to a medical condition of some sort. People with obesity are at high risk of developing plantar fasciitis. If you have high calf muscles that make it difficult to flex your foot so you can bring your toes towards your shin, then you are prone to developing plantar fasciitis as well. If you have structural foot problems, such as, let's say, very high arches or very flat feet, then you're also at risk of developing plantar fasciitis. Having tight Achilles tendons can result in plantar fasciitis as well. And your Achilles tendon is the tendon that attaches your calf muscles to your heels. Wearing shoes with inadequate support, such as soft soles or poor arch support, can also lead to the development of plantar fasciitis. So what are the symptoms of plantar fasciitis? The main symptom of plantar fasciitis is stabbing pain at the bottom of your foot near your heel. The pain is usually worse in the morning after waking up, similar to polymyalgia. So I believe because the body is inactive and your muscles and everything becomes stiff, so that's why the pain is worse in the morning. And pain can also be triggered by long periods of standing or getting up after sitting. Pain is also experienced after exercise, but funnily enough, not during exercise. Now, this one I couldn't actually explain in my head, or I couldn't wrap my head around why, if you've got an injured ligament or injured tissue under your foot, by your heel there, there's no pain during exercise, but there's only pain after exercise. So I don't know, I don't understand how the body does that, but that's, I guess it's a kind of like a magical thing in my mind, like the body can actually do that. Plantar fasciitis pain develops gradually over time, and the pain can either be dull or it can be really sharp. Some patients report a burning feeling at the bottom of the foot extending outward from the heel. Now, what are the current treatment options for plantar fasciitis? So this, we're about to get to where it's a bit exciting, I guess, as to whether CBD oil does work or how it can work. And if you're a regular listener of this particular podcast, I'm sure you can already see where this is going, and I'm sure you can already see how CBD oil is actually going to work, because I'm not going to hold back this information. CBD oil will work for the inflammation side of things, and there's certain studies, and for the pain as well. But yeah, I just wanted to say that, because if you've been listening, most of the conditions that I've covered so up to this point, I've had to deal with joint pain, joint pain and inflammation. Really, like that's where I've been researching, or those are the conditions that I've been looking at and understanding, and then seeing what kind of help CBD oil can provide. Now, most people who develop plantar fasciitis recover in several months with conservative treatment options. Home treatment options such as resting, icing, wearing braces, stretching the affected area, and over-the-counter anti-inflammatory drugs and painkillers are often the go-to forms of treatment. So, it's basically about managing pain, managing inflammation, and allowing your foot to heal, allowing that damaged tissue to repair itself, letting your body do its thing. Something called night splints are also used to help stretch your calf and the arc of your affected foot. Night splints are a type of brace that holds your foot in a flexed position. They lengthen the plantar fascia and Achilles tendon overnight. As a result, they prevent morning pain and stiffness. Special arc supports for your shoes help alleviate pain as well by distributing pressure as evenly as possible. Arc supports can also prevent further damage to the plantar fascia. Now, if these treatment options that I've just mentioned do not work to ease the pain, you can get a corticosteroid injection directly into the damaged section of the ligament. Cortisone, for example, is a strong steroid injected into your plantar fascia to reduce inflammation and pain. Now, doctors limit this type of treatment because multiple steroid injections in your foot can rupture or tear your plantar fascia, leading to a flat foot and chronic pain. So the next thing that people actually look into is physical therapy. And just before I get into that, and I think this is part of the reason why people are looking into CBD oil as a form of treatment, viable treatment for plantar fascia, especially because they're dealing with pain and inflammation. Because yes, if your over-the-counter medication is not working or it's not adequate enough, which there's a cancer patient study in 2010 where the patients were on strong opioids, and the strong opioids were not doing anything for the pain. And, lo and behold, cannabis came in and provided much better pain relief for those patients. I can imagine the same thing happening for someone with plantar fasciitis, where they're doing all the right things, right? You're resting your foot, you're putting ice on there, you're taking over-the-counter anti-inflammatory drugs, and you're also taking over-the-counter painkillers. But the result is inadequate. It's not doing much for the pain. It's not doing much for the inflammation, and the inflammation could be contributing to more pain being experienced by the patient. And then the next thing you do is you go to your doctor and he says, "Oh, look, this stuff isn't working." They can give you corticosteroid injections directly under your foot. However, there's a limit on what the doctors can do, because doing that can actually make things worse. You can go from having an arc in your foot to having a flat foot. Then all of a sudden one foot is flat, one foot has an arc. So you've got weird feet. It might affect your walking and stuff like that. It might lead to all sort of complications. By the way, by looking into this, I can see that it can lead into so many different complications. And also, your pain can go from what you were dealing with to something that's chronic, which is much, much worse. Like, it's something you do not want to actually experience. So this is just this section alone. I can see why patients on the internet are looking into CBD oil, and why people are asking, can CBD oil actually work for plantar fasciitis? Because I can see this being one of the key driving problems that exist in the medical marketplace. As to why people prefer to use CBD oil, because For one, we already know that corticosteroids come with side effects. Number two, the doctor has to limit how many he can provide because it can actually make your condition worse. And number three, CBD oil for the most part is kicking a lot of butt in regards to conditions, and we're going to get into that in a moment. Now, the next form of treatment that's currently available, which I personally believe is a step in the right direction, pun not intended, is physical therapy. So it plays a key role in treating plantar fasciitis. Physical therapists can show you exercises to strengthen your lower leg muscles, stretch your Achilles tendon and plantar fascia. This helps stabilize your walk and lessens the workload on your plantar fascia, especially if you're going through plantar fasciitis, if you've got that condition. So I personally believe physical therapy is something worth considering with this condition. But first of all, let's figure out how we can look at managing pain and inflammation. Now, surgery is also an option in regards to treating this condition. It is the most dramatic form of treatment that you can use and also the last resort. Surgery is only considered 12 months after aggressive non-surgical treatment is proven to be unsuccessful. So you've gone through everything that we've spoken about leading up to this point. You've gone through your home treatment, you've gone through physical therapy and you've gone through corticosteroid injections. You've gone through all the non-surgical but aggressive forms of treatment, and none of it is successful. And you've been doing this for at least 12 months. Then your doctor would consider looking into surgery to actually help you heal, to help you recover, to help you help your body repair itself. Now, if you have a difficult time stretching your feet, even after consistent stretching, your doctor may recommend a procedure called, now hopefully I can say this correctly, gastrocnemius recession. Gastrocnemius recession. That's what the procedure is called. Again, this medical field is like, I'm learning a whole new language here, so hopefully you're learning with me. And look, if you're watching this or if you're listening to this podcast on YouTube, because that's one of the places that actually do put this out, please feel free to let me know how to actually pronounce some of these words if I'm butchering them. But if it's not important to you either way, let's keep moving. Now, this procedure involves lengthening your calf muscle to increase ankle motion and reduce stress to your plantar fascia. Now, if you have normal range of ankle motion with ongoing heel pain, then your doctor can recommend a partial release procedure. That's actually easy to pronounce. Why don't they do this with everything? Why does it have to sound like a different language all the time I'm reading this stuff? Anyway, so your doctor may recommend a partial release procedure. This involves partially cutting your plantar fascial ligament to relieve tension in the tissue. And if you have a large bone spur as well, it may be removed too, because there's still that belief that a bone spur or heel spur contributes to the development of plantar fascia, although again there's many cases of people who have heel spurs but have no pain and no plantar fasciitis. Now, the problem with surgery is that it can also result in chronic pain, right? It can also result in chronic pain, and it can also result in nerve damage. It should only be considered after trying other treatment options. And I personally believe this leads us to the question of the day, which is, does CBD oil work for plantar fasciitis? All right. So before I get into what I'm about to get into, what I can already see in my mind is that there's three things to consider here, right? When you're treating for plantar fasciitis, the main thing you're looking at doing is if you can, accelerating that healing process, right? The next thing is pain management and inflammation management. So where I can already see CBD oil, without even going into what I've already written on my blog post, the way I can already see CBD oil providing value for a patient is that it can help with managing pain, providing pain relief basically, and also alleviating inflammation. So being anti-inflammatory. Those are the two areas. In regards to maybe accelerating the healing process, there's not enough evidence yet that CBD oil can do this, although there is one study that I'm still wrapping my head around, so I don't talk about it, but just to give you an idea of what I understand about that particular study, where they were looking at rodents, and in those particular rodents, they induced arthritis, and they found that CBD oil actually kind of accelerated the healing process in the arthritis of the rats. But the thing is, I still need to, because that particular study was written with so much medical jargon. I couldn't wrap my head around it, so I couldn't explain. I don't understand it completely, and it's even difficult. You can even hear in my voice, it's very difficult for me to actually explain it to you, which is why I don't reference it, because I don't get it yet. But once I do, I'll be able to reference that and see if it actually provides any hope for the future use, or maybe even future studies of CBD oil in regards to accelerating the healing process within the human body for specific conditions related, let's say, to the joints or ligaments or soft tissues or anything like that, your tendons. However, let's get into what I do understand about how CBD oil can work for plantar fasciitis. So based on my research so far, I can confidently say that CBD oil will work for plantar fasciitis when treating for pain and inflammation, which is what I've just mentioned. So cannabidiol, CBD, has been shown or has shown to be effective for multiple forms of inflammation in human and rodent model studies. And CBD combined with THC is shown to be effective for pain relief in human studies. All right. In a 2009 peer-reviewed journal, the authors state that cannabinoids have been tested in several experimental models of autoimmune disorders such as multiple sclerosis, rheumatoid arthritis, colitis, and hepatitis. These studies have shown that cannabinoids protect the host from the pathogenesis through the induction of multiple anti-inflammatory pathways. Now, pathogenesis is a biological mechanism that leads to the development of a disease. So in short, cannabinoids actually suppress inflammatory response and weaken disease symptoms. All right. The authors also state that cannabinoids may also be beneficial in certain types of cancers that are triggered by chronic inflammation. In these cases, cannabinoids can either directly inhibit tumor growth or suppress inflammation and tumor angiogenesis. Now, angiogenesis is the development of new blood vessels. So in short, in that one as well, cannabinoids can actually suppress the development of new tumors, because it's suppressing tumor angiogenesis, and angiogenesis, the development of new blood cells. So it can actually suppress the growth of new tumors. So the authors conclude their journal by stating that overall cannabinoids have, and I quote, sorry. So the authors state, and I quote, overall cannabinoids have exhibited the significant potential to be used as novel anti-inflammatory agents, and specific targeting of CB2 receptors in our body holds the promise of mediating immunosuppressive effects without exerting psychotropic side effects. So my understanding of that statement is that cannabinoids can be used as anti-inflammatory agents by targeting specifics. Now, we've got CB2 receptors in our body. We've got CB1 and CB2 receptors in our body. So CB2 receptors in our body are the ones that deal with inflammation, and it has immunosuppressive effects without making us basically feel high, because that's what it means by saying without exerting psychotropic side effects. So you won't get high, you will not feel high, you will not have symptoms of being high by the use of CBD oil or cannabinoids specifically. And in turn, what you're going to actually experience is anti-inflammatory effects, because there's actually sectors in our body called CB2 receptors that are a target to work in that way, whereby once you have the cannabinoid in your system, it plugs into your CB2 receptor, and then it triggers anti-inflammatory effects in your body. Now, in a 2019 peer-reviewed journal, the authors state that an increasing number of patients with rheumatoid arthritis use cannabis to treat their symptoms, even though there is a lack of systematic studies. So patients, all right, that was the opening statement. So patients are not sitting around waiting for the medical community or the medical industry to come out with studies to say that, yay, CBD oil works for rheumatoid arthritis or anything like that. They're just basically going out of their own way and saying, you know what, FTS, hopefully you know what that means. But they're saying enough is enough. I'm just going to go ahead and try this out, and based on their personal results, they're concluding that it actually works. But let's get into this. Let's finish this off. So recent findings show that cannabinoids display anti-inflammatory effects by activating cannabinoid type 2 receptors, again CB2 receptors, which decrease cytokine production and immune cell mobilization. And if you don't know, cytokines are protein molecules that mediate and regulate immunity and inflammation. So if it's by plugging, now let's see if we actually understand the science here. The way cannabinoids work is that they plug into your CB2 receptors, which we are just talking about it as well just now in your body. And part of what they do to reduce inflammation is that they decrease cytokine production and immune cell mobilization, because cytokines are protein molecules that actually mediate and regulate immunity and inflammation. Now, the authors go on to state that cannabidiol, CBD, has demonstrated anti-arthritic effects independent of cannabinoid receptors. Not only do cannabinoids control inflammation, but they also reduce pain by activating central and peripheral CB1, peripheral CB2, and CBD sensitive non-cannabinoid receptor targets in our body. So they activate all these things in our body, CB1, CB2 receptors, and non-CBD sensitive and CBD sensitive non-cannabinoid receptors in our body to produce anti-inflammatory effects. In a 2017 peer-reviewed journal, the authors state that CBD does not produce psychotropic effects. So this is for anyone who's worried about getting high by taking CBD. It does not produce psychotropic effects. It has been shown to produce a variety of pharmacological effects, which is we're talking about anti-inflammatory effects and pain relief effects, analgesic effects. Natural and synthetic phytocannabinoids have produced clear activity in a variety of models of joint pain in animals. These effects are the result of both inhibiting of pain pathway signaling, mostly CB1 receptors, and anti-inflammatory effects, which is mostly CB2 receptors. So think about it this way. You've got what's known as the endocannabinoid system in your body. And what we understand about it so far is that there's two types of receptors in that system. One is called CB1 and the other one's called CB2. CB1 receptors generally deal with pain, and CB2 receptors generally deal with inflammation. So what that statement is saying is that the effects of the effects of natural and synthetic phytocannabinoids have produced clear activity in a variety of models of joint pain in animals, I guess as well as human, because now we've also looked at rheumatoid arthritis studies. And these effects are both the blocking of the pain pathway signaling, which is the CB1 receptor, so blocking pain or inhibiting pain signaling. So if you do have pain, that's how it produces pain relief effects, and also anti-inflammatory effects, which is the CB2 receptor. So that's what CB1 would help. Like when you take a cannabinoid, if you've got pain, it goes to your CB1 receptor in your body or receptors in your body. And if you're dealing with inflammation, it goes to the CB2 receptors in your body to help reduce the inflammation. Now, according to the authors of this very same peer-reviewed journal, there are numerous anecdotal reports of the effectiveness of smoking cannabis for joint pain relief. And I'm not surprised, because on a side note, the cannabinoid that is prominent and dominant in any, I guess, in any cannabis flower is THC. Now, it's not the only one, it's just the most dominant one. And there are studies, if you listen to previous episodes of this podcast, there are studies that show that CBD combined with THC in a 1-to-1 ratio does produce very effective pain relief effects. However, not everyone is open to smoking cannabis or smoking a joint, because not everyone wants to get high. People, by looking at what's happening in the market at the moment with patients, people want the therapeutic effects, but they don't want the psychotropic effects. Right? No one wants to get high, but everyone wants to feel good. Like they want to relieve pain, they want to relieve inflammation, they want to heal, but they don't want to get high, if that makes sense. But I'm not surprised when the authors state that there are numerous anecdotal reports of the effectiveness of smoking cannabis for joint pain relief, because there is THC in there, and most CBD products in the market at the moment have very, very low amounts of THC. I think the most legally required, by the way. So the highest legal limit of THC in a CBD oil product is 0.3%, which is mainly in the US. In Europe, The highest legal limit is 0.2%, but you can have as much CBD or other cannabinoids in there as you want. And again, this is because I personally believe part of the reason is because they're trying to meet the market demand of not getting high, but getting the therapeutic effects that come from those cannabinoids. But two, as well, I also, now this is my own personal belief. I kind of personally believe that the medical industry doesn't want to have not I won't use the word significant levels, but high enough levels or formidable enough levels of THC in a CBD product to that would produce pain relief effects. Because if that happens, let's say, for example, it takes about 10% of THC for you to start feeling high. But if you have 5% THC in your CBD product, you won't feel high, but you still get the the therapeutic effects that come with combining CBD and THC. Then that would throw a lot of the painkillers in the market, all the over the counter medications, all the anti-inflammatory medications that are currently in the market, out the window, and people be able to grow this plant from home. So that's why I personally believe that that's the case as well, why the legal limit is so low, because the medical industry already understands, and I've already looked at studies going far back as 2005, that they know that when you combine THC and CBD in a 1-to-1 ratio, that it produces way better pain relief effects than even the strongest opioids, and I'm referencing a 2010 cancer patient study. So that's my personal belief. That's my personal side note. But let's keep moving on with today's content. The reports generally do not extend to regulated clinical trials for rheumatic diseases. However, the authors conclude by stating that the preclinical and human data that exists indicates that the use of cannabis as a potential treatment of joint pain should be taken seriously. Okay, so this includes plantar fasciitis, because more or less that can be considered a form of joint pain, right? Now, in a study published in 2011, researchers set out to investigate whether the endocannabinoid system is involved in the control of pain in the human Achilles tendons. Now, the researchers looked at the expression of the cannabinoid receptor CB1 from healthy volunteers and from patients with Achilles tendinosis. Now, this is something I looked at in my first ever piece of content. I was looking at, does CBD oil work for tendinitis? And I'm glad to revisit this to cement the understanding that whether or not you're taking CBD oil for joint pain or for Achilles tendinosis, or for plantar fasciitis, this study showed me basically, which I'm gonna basically get into, but this study showed me that your your endocannabinoid receptors actually get triggered when these conditions when these conditions are evident in your body. So when you have Achilles tendinosis, your endocannabinoids are ready to receive cannabinoid or endocannabinoid and cannabinoids and endocannabinoids. They're open to receiving them. Anyway, so the researchers found that the expression of cannabinoid receptors CB1 is increased in human Achilles tendinosis compared to healthy patients. Again, we mentioned that CB1 receptors, or cannabinoid receptor 1, it mainly deals with pain signaling. So if you've got Achilles tendinosis, of course you've got pain in your heel or close to your heel or in your Achilles tendon. And your CB1 receptors are expressing themselves so they can receive either endocannabinoids that your body produces, because that's what endo basically means. It's produced from within the body. And we have found endocannabinoid science. When I say we, I mean the medical community has found endocannabinoids, or has identified endocannabinoids that do fire up. But also, if let's say your body cannot produce or is not producing enough endocannabinoids, then that's when CBD oil comes into place or cannabis comes into place, and those cannabinoids can still plug into those CB1 receptors to help reduce pain. And if they're looking for CB2 receptors, I'm sure they would find them as well to help reduce inflammation. So the CB1 is a target in our body for cannabinoids in cannabis to plug in and provide pain relief. That was my final statement on that blog post. If you want to read that, go to HempNerd.co. In a 2019 fibromyalgia patient study, varying CBD solutions were used to test the effectiveness of cannabis for pain relief. Researchers found that a combined solution of CBD and THC produced the best pain relief results in patients. This solution was tested against a CBD dominant solution, a THC dominant solution, and a placebo. The patients who received the combined THC and CBD solution reported a minimum of 30% reduction in pain. Minimum. So 30% minimum reduction or more from an initially measured baseline. So obviously they measured their baseline. They're like, okay, my pain is, let's say, a 9. They had a minimum of 30% improvement, and maybe that went from a 9 to I'm just putting numbers out of the air here, let's say a 6 or a 5 at a bare minimum. I'm sure there are people who went through this who had better results, but that was their minimum. So the researchers concluded that CBD combined with THC in a 1-to-1 ratio is most effective for pain relief in fibromyalgia patients. Fibromyalgia, if you don't know, is a chronic pain syndrome that causes musculoskeletal pain, joint pain, tenderness, tiredness, fatigue, anxiety, and a host of other symptoms. Now that's in 2019 for fibromyalgia. There's also a 2010 study on cancer patients where a group of cannabis-based medicines was used to determine the effectiveness of cannabis on patients with advanced cancer pain. The patients were on strong opioids. So this is the study I was referencing earlier. They were on strong opioids before the study and did not experience adequate pain relief results. And I can only imagine what kind of pain these people were going through. The cannabis-based medicine studied were a THC dominant solution and a combined 1-to-1 solution of CBD and THC, and of course a placebo. The study found that the combined solution of CBD and THC produced the best pain relief results. It produced significantly better pain relief effects than the THC dominant solution. And the reason I mention that is because this is now addressing the recreational cannabis use crowd where they believe, oh, just smoke a joint and everything will be okay. There's a limit to that, because as you can see, when you use a bit of science here and you apply a 1-to-1 ratio of CBD and THC, you actually get better pain relief results than a THC dominant solution, which is what currently exists in the cannabis black market, if you want to call it that, or the cannabis black market, because most of these hybrid cannabis products that they're coming out with, that people use to make their joints or to smoke their joints with, are THC dominant. Yes, they do have other cannabinoids in there. They've got CBD and they've got CBG and CBN and all these other cannabinoids. There's over like 100 different cannabinoids. There's terpenoids as well. They've got all that jazz happening for them in there. But the most dominant cannabinoid is THC. And again, looking at this study, this clearly shows that, especially for pain relief, because I'm sure if someone with the most dominant symptom with plantar fasciitis is pain. And of course, if you didn't know, cancer, specifically blood cancer, is known to cause pain and inflammation in your joints, muscles, tendons, bones, and soft tissue as well. Having a CBD and THC combined solution in a 1-to-1 ratio is going to provide you the best pain relief results. And we also know that CBD by itself is also going to provide you with some anti-inflammatory results as well, because that's what that's what CBD does, and it's going to obviously go to the CB2 receptors, because those are the receptors responsible for the anti-inflammatory effects that you want to experience. And then THC is going to go to this is how I see it working in my mind. If there's someone out there listening in the medical community who understands this better, please feel free to reach out. I'll be more than happy to have a chat with you. But for the most part, THC would also obviously target your CB1 receptors to then reduce pain. So, what are my final thoughts on this? What are my final thoughts on this topic? Does CBD oil work for plantar fasciitis? I personally believe it does. From the studies made publicly available, and there's more I could have gone into, and it would have taken me more time to do that. But there's more I could have gone into to support my belief, my objective view. But there's enough data to conclude that CBD does provide potential anti-inflammatory and pain relief effects. And when I say CBD, I mean CBD oil, more specifically a full spectrum product. Plantar fasciitis is described as the inflammation of your plantar fascia due to injury. Thus, it is in my objective view that CBD oil is a viable form of treatment for pain and inflammation, especially within that first year caused by plantar fasciitis. However, it is also my objective view that physical therapy must be applied in combination with CBD oil for the best results. So it's not enough just to take CBD oil for pain and inflammation. I personally believe that it is also relevant and smart of you and required. Like, look, I'm not a doctor. Again, I'm not a doctor, but just reading all this, researching this, and providing the best answer I can possibly provide in this point in time, it is my objective view that a combination of CBD oil with physical therapy will do that, and time to give your plantar fascia to heal is a recipe for success. That's what I personally believe based on doing this homework. So obviously, finding a pro cannabis doctor is, I personally believe right now, for anyone considering using CBD oil as a form of treatment, finding and working with a pro cannabis doctor should be number one on your priority list. Number one. It doesn't matter if there's no one in your area. Look in your state, in your country, internationally. Like, we have the internet now, so it should not be an excuse. Please do find a pro cannabis doctor you can work with, and then that should be like number one on your priority list. And from there, we can start to use CBD oil plus physical therapy plus time to allow you to allow your body to heal, to reduce inflammation, and to reduce pain. Now, if you're after anti-inflammatory effects, then your best option, and only anti-inflammatory effects, then your best option is either a full spectrum CBD product or a broad spectrum CBD product, because CBD alone is shown to have anti-inflammatory effects. Now, if you're after both anti-inflammatory and pain relief effects, your best option is a full spectrum CBD product with a 1-to-1 ratio of CBD and THC. Why do I say this? Because CBD and THC, as you already know, combined have shown to provide significant pain relief effects in patients with chronic pain, where even strong opioids could not deliver on the result. Now, there is a legal challenge with getting a full spectrum product with a 1-to-1 ratio of CBD and THC at the moment. Hopefully this will change for the better in the future. But the legal challenge at the moment is that the current regulations surrounding THC, which I've glossed on during this podcast as well, is the maximum legal limit, where in the US it's 0.3% of THC in a cannabis-based product, and in Europe it's 0.2% as a maximum limit. So your next best option, right, is to find a full spectrum product with as close to a 1-to-1 ratio as possible. So as much legal THC as you can get in your product as possible, if you're after pain relief effects as well. But if you're only after anti-inflammatory effects, then CBD alone will do the trick. Now, I feel like I really need to stress this point. I've already stressed it in this podcast, but it goes without saying this point, that you need to seek a pro cannabis medical professional. I'm not a pro cannabis medical professional. Sometimes I wish I was. Sometimes I wish I actually studied medicine and then embarked on the journey that I'm on now with that medical background, but I'm not. However, I am doing my part to provide as much information as possible, so when you do find a pro cannabis doctor, most of the groundwork is already done, and then it's just a matter of you working with that doctor, getting the results, using your experience as a case study, to which I personally believe that doctor is gonna use to fight the case to say that medical marijuana or medical cannabis should be a home state in our medical system, as opposed to some of the drugs that we have currently at the moment, which are doing nothing, in fact making things worse for people. But yeah, find a pro cannabis medical doctor to work with when using cannabis as a form of treatment for your plantar fasciitis or any other condition. Monitor and document your results with your doctor so you can make the appropriate adjustments where necessary, leaving zero room for guesswork. Journal the type and or form of cannabis you're using, your dosage amounts, and how often you consume it during the course of your day. And seek out products that have been regulated and tested so you can be confident that you are taking a clean and safe solution. Speaking of which, I am working with I'm working with a few companies at the moment to see if I can actually provide some clean and safe products, especially to the Australian market, because I don't believe enough is being done in the Australian market, which is where I live, to provide high quality. We can even call it medical grade CBD oil. So I am in talks with some European companies and some US companies to actually get this in play. And hopefully in the next episode, of the Hemp Nerd podcast, I'll be able to make an announcement to say that, hey, look, if you live in Australia, follow this link and get yourself some high grade, high quality, clean and safe CBD oil. But in the meantime, just know that this is something I'm actually working on. And, hopefully I can help serve you in this way. Not only can I provide you with content, but I also be able to provide you with a product source that you can trust and is actually going to do good things for your body. And of course, your doctor approves of as well, because there's no point buying whatever I recommend if your doctor does not approve of it. So that's another step you need to get in place. But right now, just keep your ear to the street, as they say. And hopefully I believe by next week I can make some announcements, but I'm still working on some stuff, and we'll see how things go. But keep in mind that when you're seeking out products, make sure they've been regulated and tested so you can be confident that you're taking a clean and safe solution. Keep in mind that cannabis is not a one-size-fits-all solution as well. What works for a friend or a colleague or a family member may not work for you, which is fine. However, cannabis does provide the opportunity for you to figure out and determine what will actually work for you based on what condition you're treating. In this case, we're talking about plantar fasciitis. And in working with a pro-cannabis doctor, your results could be used as a case study to support cannabis use as a widespread medicine in the medical community. Now, if you enjoyed this particular podcast and you want to, dive into the references, all the studies that I referenced in this episode, please go to HempNerd.co. The blog post, does CBD oil work for plantar fasciitis, will be right in front of your face. If you are listening to this within the first week of July 2020, but it won't be very difficult to find. If you just go to HempNerd.co, you'll be able to find it. And you can click those links and actually nerd out on some of the information that I had to read to put this together. And that's pretty much it. Like, I've no special announcements. Hopefully I'll have one next week. But in the meantime, stay safe, be careful. Please find a pro-cannabis doctor to work with, so that he or she can recommend products. Of course, hopefully I'll be able to recommend some products to you guys next week, especially if you live in Australia. I know a lot of people listening to this show also tune in from the US. I'm grateful and thankful for your time as well. And depending on how things go over the course of the week, the next week leading up to the next episode, I may be able to open up my doors to the US market as well. But I highly, highly recommend, please look, I am not a doctor. I'm an entrepreneur at the end of the day, but I care a lot and I'm researching a lot. I want to make sure I'm doing my due diligence before I can go out and start making these kind of offers to say, hey, look, buy from me because of XYZ reason. I want you to make sure as well that you're doing the right thing by yourself and also by your family members, because looking after your health is a duty you have, because there are people in your life that care for you, care about you, and that you need to be there for. So I personally believe this is a way of us helping each other to make sure that we can be there for those who love us and those who we love as well. So we're looking after ourselves, looking after our mind, our body, our spirit, and making sure we're taking the right medications and making sure we're getting the right advice from people who actually know what they're talking about. I intend to become one of those people who knows what he's talking about, but at the same time, I don't have that qualification that says doctor. So please find someone, who has that qualification, who is pro-cannabis as well. Because it's not enough, these days it's not enough just to be a doctor, because we also know how, big pharma works to an extent. So you have to go that extra step to find a doctor who is pro-cannabis. I think I'll be stressing this until I can't stress it anymore. Anyway, thank you for your time and your attention today. Thank you for tuning into the Hemp Nerd podcast. I really appreciate your time and your attention, and I will catch you on the next episode. And for all reference links, go to hempnerd.co. Take care, God bless, and we'll tune in next time. Peace.